Oxycodone was first approved by the Federal Drug Administration in 1996. It was first marketed by Purdue Pharmaceuticals as Oxycontin. Oxycodone is derived from opiates. Opiates are found in the poppy flower, usually grown in Asia. Opiates have been used medicinally for centuries as painkillers, muscle relaxants, and diarrhea remedies. Oxycodone is used for patients with chronic pain or long-term pain, such as cancer patients. Oxycodone also produces euphoria and feelings of relaxation, which has resulted in abuse and street popularity. Researchers have stated that abusers compare the high of oxycodone to 10,000 orgasms. Some of the common street names for oxycodone are Oxycontin, hillbilly heroin, and poor man's heroin.
Oxycodone is beneficial to many terminally and chronically ill patients. As with any other controlled drug, this too will be abused. Physicians and pharmacists work together to regulate the dispensing of all controlled substances, such as oxycodone. Along with other drugs, abusers find a way to acquire these drugs, generally by purchasing them from others at $5 to $10 a pill, depending on the dosages. Oxycodone is made of 18 carbons, 21 hydrogens, and 4 nitrogen oxides, and is combined with hydrochloric acid. Oxycodone's chemical structure is very similar to morphine. Oxycodone, like morphine, blocks the pain receptors in the brain. Oxycodone promotes the release of the neurotransmitters dopamine, acetylcholine, and norepinephrine. The agents that bind in the opioid receptors are found in the central nervous system and gastrointestinal systems. The receptors of these two systems produce both beneficial effects and undesirable side effects. Some of the side effects associated with the abuse of oxycodone include hallucinations, confusion, seizures, difficulty swallowing, and difficulty breathing, and can ultimately lead to death.
Oxycodone can be prescribed in 10, 20, 40, 80, or 160 milligram dosages. Oxycodone is typically given in a controlled release form, meaning the drug is released slowly as to give a more even amount of pain relief. Abusers will typically crush the tablets, therefore releasing the full effects of the drug. Abusers will then either inject, snort, or smoke the alternate form, producing the desired euphoric effect.
We spoke with the pharmacist, Dennis Sona, about oxycodone.
Hi, I'm Dennis Sona. I'm the pharmacy manager here at Walmart in Glasgow, Kentucky, and I've been asked today to speak a little bit about oxycodone and some of the products. Oxycodone, or Oxycontin, first came out on the market about 1996. What we see here at Walmart with the oxycodone products is mainly used for long-term illnesses such as cancer. We see some use for a surgery, but mainly it's going to be our long care patients with long-term disease. When Oxycontin first came out on the market, of course, it hit a lot of street news because of drug abusers. This drug was going for about $5 a tablet for the 10 milligram and about $10 a tablet for the 20 milligram. Today that has fallen off quite a bit because most pharmacies do not even want to carry Oxycontin because of either theft or from being held up. Robberies were quite prevalent for several years because of the drug. Today, however, now with generics on the market, we use a lot more of the generic products for our patients. Oxycontin or oxycodone comes in a variety of forms. It comes in tablets, capsules, sustained release, extended release products, also in combination with either aspirin or with Tylenol. Most typical patient, again, is going to be our cancer patients. As far as, again, the abuse potential, we don't see a whole lot of folks coming in here with forged prescriptions trying to obtain Oxycontin. We have a very good working relationship with all the doctors in this community, and we don't see much of that at all. Again, because of the legal folks or the law enforcement people getting involved with it, we have very little abuse today as far as in the retail pharmacies.
With pharmacists, physicians, and police working together, maybe they can promote the benefits and lower the liabilities of oxycodone.